Welcome to the Oncology Nursing Podcast. Today's episode is part of our Health Policy and Advocacy series. Nurses are the most trusted profession in the United States and have an important voice in shaping health policy work at the local, state, and national level. These episodes give oncology nurses a chance to hear from the nation's top leaders and gain understanding of how federal legislation is implemented and affects public health. Thanks for listening to the Oncology Nursing Podcast. Due to COVID-19, the National Comprehensive Cancer Network, NCCN, has lowered the threshold for the use of myeloid growth factors to include chemotherapy patients at intermediate risk for febrile neutropenia. Hello and welcome to the Oncology Nursing Podcast. I'm your host, Lisa Kennedy Sheldon. I'm the Clinical and Scientific Affairs Liaison at the Oncology Nursing Society. Today we're joined by Dr. Lisa Richardson from the Center for Disease Control. Dr. Richardson is the Director of CDC's Division of Cancer Prevention and Control. She's responsible for providing leadership and direction for all scientific, policy, and programmatic issues related to 4 national programs: the Colorectal Cancer Control Program, the National Breast and Cervical Cancer Early Detection Program, the National Comprehensive Cancer Control Program, and the National Program for Cancer Registries. She oversees a well-developed research agenda that includes the National Cancer Prevention and Control Research Network. She continues to provide clinical services to cancer patients at the Atlanta Veterans Administration Medical Center. Thank you so much for being with us today, Dr. Richardson.
Thanks for having me.
Yeah, the work of the CDC includes such innovative communication approaches and evidence-based programs to promote cancer prevention, screening, and early detection, as well as survivorship. Oncology nurses appreciate creative ways to reach and support their patients. Would you tell us more about your new resources at the CDC?
Well, in addition to our educational campaigns like the Bring Your Brave, Screen for Life, and Inside Knowledge, which is for gynecologic cancers, we're always looking for innovative ways to reach people like social media. One initiative that we're really proud of right now is Talk to Someone, which is a virtual human simulation named Linda. Linda is a virtual cancer survivor, triple-negative breast cancer survivor, who we have a simulation for talking about triple-negative breast cancer treatment. But Linda is also a survivor that educates survivors on alcohol use, tobacco use, anxiety, distress, physical activity, and nutrition. And so what we're striving for right now at CDC is to provide more resources for cancer survivors to live a healthier lifestyle after having cancer, because we know that will help them live healthier and longer if we take care of those at the point of diagnosis.
That's great. So your resources really go across the trajectory of cancer care, from prevention and screening right through survivorship.
Oh, absolutely. And our initiative for the last couple of years has been to concentrate more on health and wellness in cancer survivors. As you know, Lisa, there's about 30 million survivors in this country. Not quite there yet, but it's a larger and larger population of people that we have to be concerned about.
Oh, absolutely. And the care doesn't stop just when the treatment stops, does it? So it's fantastic that the CDC has created these resources. I was really struck by the avatar that you've used with Linda to be able to talk to people in a way that feels less institutionalized, like in a medical way, and more a conversation with this animation and the avatar.
Yeah, so when we tested the Linda simulation at Northside Hospital when we were actually doing the research and beta testing and all that. And all of the nurses there talked about her like a real person. So, she's for triple-negative breast cancer treatment, talking through the, what you have to do, what it is. But everybody would say, we need a Linda for that. So it was very well received by the nurses at the hospital that we have worked with to develop. And on the survivorship side, we're now in the process of doing a Medscape CME medical education hours and nursing education hours. And that should be available sometime this year.
Oh, that's wonderful to hear. Looking for more resources for continuing education and professional development.
Absolutely. And something interesting too. How about that?
Always interesting. I would like to switch over to something that's certainly top of mind for most healthcare providers, and that's COVID-19. And we know that nurses are on the front lines of dealing with this pandemic and also trying to provide care for their patients with cancer. We've also seen, though, a marked decrease in cancer screening, such as mammograms and colonoscopies, maybe resulting in later stage diagnoses and even increased cancer mortality. What can the CDC and professional organizations such as ONS do to help during COVID-19 and to safely promote cancer screening?
So, on that one, I think what we're learning, Lisa, is that the main challenge that we're going to have getting people back into care is dealing with the fear that they have of coming in for care right now. I think many of us, including myself, we know that we need to have these things done. We know these things, but the fear is really strong. So thinking about how we're going to do some messaging here at CDC, and would love to have ONS help with this as well, is how do we address the fear first? And then we can start talking about getting it back into preventive care with screenings, because the fear is palpable. And when you talk to patients, and I'm sure you have in your clinic, it's just people are just terrified basically of coming in for care. So whatever we can do to help with that, I think you guys have guidelines for how to, restart care in the oncology setting and be, aware of COVID and keep patients as safe as possible.
Yes. And, there's been, discussion about not just routine screenings, but patients coming in and being seen for symptoms that could result in a cancer diagnosis. And so that anxiety is on multiple levels and keeping people from coming in even for treatment. We've talked about cancer centers probably being cleaner than a lot of facilities, than a supermarket to go in, but it's hard to convey that message to our patients so that they feel safe coming back in for treatment, coming in for screening.
Yeah, so one of the interesting things there, Lisa, is that we did this campaign. Well, we are still doing it 11 years later with the CDC Foundation, Prevent Infections in Cancer Patients. And so one of the things that, in nurses, you guys know this better than anyone, that we discovered when we did that campaign, it had two sides, the outpatient clinic side as well as the patient caregiver side. And what is not known is that there really aren't standard guidelines out there for outpatient clinical settings, including oncology. So as part of the work we did with Prevent Infections in Cancer Patients, we developed a guide for keeping your clinic safe in an infection control way, and happy to share those resources with you guys as well. I think we have a couple times, but we can reshare for people. But to download, and how do you keep your clinic, how do you do infection control in your clinic? And so we built those materials specifically about 8 years ago, and they've been very successful, downloaded quite a bit.
Oh my goodness, you were way ahead of your time. We have a whole new level of infection prevention at this point than we ever had before. But people and caregivers in cancer care are very aware of the fact that many patients, either because of their cancers, such as hematologic cancers, or because of their treatments, have lower immunity and are more at risk for infection, and even infection with the COVID-19 virus.
I did one of your theaters. I can't remember what they're called at your meetings, where you have different groups of people come and talk about their work. So we've done several of those with you all at your meetings, and ONS has been very open to working with us to get the word out to providers, nurses, nurse practitioners, PAs, and others about infection control. So we appreciate that here at CDC.
Oh, we've been very grateful, frankly, for your resources in the past, but even your more current resources that have been available to help us inform our members about how to take care of their patients during this pandemic as well. So thank you for that, and for working on behalf of the healthcare providers as well as the patients who need the treatment.
Yeah, it really is one of those things where it is a two-sided coin, right? The patients and providers have to work together to make sure that we have the best outcomes, regardless of what the outcome is we're looking for. It's, safety from infection versus living a long and healthy life, with cancer. It's all on a spectrum of care.
Yeah, absolutely. You are very involved in public health programs, and I think, certainly front and center right now during the pandemic. But you also have cancer-specific initiatives that are part of your goals. What's the process for developing and implementing successful programs for targeted cancer audiences and the general public?
So that's an excellent question, because right now what we talked about earlier is how are we going to get people back into care, all types of care, right? The surgical, screening, chemotherapy, which has been the least impacted, I think, has been the chemotherapy. But the real challenge is figuring out what people need. And you nurses, oncology nurses, obviously you're the closest to the patient. And so, just talking to patients, they'll tell you what they need if you ask them, right? And so currently what we're trying to do, we're working with the foundation on another project looking at how to communicate about lifestyle and screening with the general public as well as cancer survivors. And really the first step there is going to find out what providers think patients are looking for, but most importantly, talking to people in the community about what they need to be healthy. And that's going to be a different tactic. We usually think we know what people need, but I don't think we know what people need. Think we need to ask them and then move forward from there. So that project has just started, and we're in the information gathering phase, and we'll hopefully move forward on that. As you know, COVID has slowed down everything. So many of the things we wanted to do in person, we're trying to figure out how to do them virtually.
Yes, yes. And when you're bringing up an important point, and that's how do we go to ask people in our communities what they need? And I know there's a large push for more community-based research, community-based participatory research, where people, not just researchers, are involved in generating what are the needs and what are the appropriate interventions to promote wellness, to attract more people into screening and vaccination programs. I mean, so getting people involved who are not scientists, not clinicians, physicians, nurses is so important in developing these interventions so they can be successful and so they can be sustainable. So that's great work.
And what you just said about successful and sustainable is absolutely correct. My best example, something that I finally came to not too long ago, probably should have known this sooner, is the difference between exercise and being physically active, right? When you say exercise, people think they need to go get an outfit or join a gym or, those types of things, when really what we want people to do is be physically active. And what that means is just getting up and walking around, going on walks, in the neighborhood. Like my son, for example, he's lost 25 pounds and all he does is walk, 2 or 3 miles per day. Obviously watching his intake, but you don't need a gym membership to be physically active. And so it's sort of, how do we talk about these things and how do we sort of help people work it into their regular life activities, if that makes sense.
Yeah, and we know that, physical activity, healthy weight, nutrition are all important parts of not just, cancer prevention, just disease prevention in general and a healthy lifestyle. We're seeing in survivorship, that impetus to get more survivors, even people on treatment, physically active so they don't get deconditioned during treatment and they actually can maintain their strength and cardiovascular wellness.
Absolutely.
Yeah. Expanded guidelines from the NCCN due to COVID-19 broaden the use of myeloid growth factors such as Udenyca, pegfilgrastim CBQV. Udenyca offers dependable supply, broad coverage, and comprehensive patient support services. In addition, it provides cost savings, which can increase access to other needed medications. Learn more at www.udenyca.com. And let's talk a little bit more about cancer treatment, because we know we're starting to see more precise oncology in terms of the specific treatment for a particular type of cancer, where the ground is constantly shifting.
So our biggest contribution in that area is actually to collect the data to help others make decisions. So we have our United States Cancer Statistics Database, which covers 100% of the U.S. population. I think since 1999, all the cancer cases in our database, which is a lot. And so to your point about, so one of the biggest complaints we get of SEER and the National Program of Cancer Registries is the data are so old by the time you get them, right? What can you do with 3-year-old data? And one of our biggest initiatives at the CDC is to get closer to real-time data on the pathology, the biomarkers, like you just said. That really is how we treat cancer now, based on biomarkers and gene defects. And how can we get that information faster so that we can actually learn from treating every patient, which is you're part of the National Cancer Policy Forum. And, we've been working on the rapid learning health system forever. And I think once we can get real time or close to real time data on cancer incidents, the biomarkers, the genetic markers, I think we'll get closer and closer to being able to look at real time outcomes. So that's what we're doing at CDC to improve that side of looking at the care that people receive.
Yeah, but it's great that you have a nationalized database. I know we've talked before, as you said, at the National Cancer Policy Forum about the issues where maybe a researcher has their own data, but doesn't necessarily share it beyond a conference and a peer-reviewed journal. So having a centralized database for these many different types of cancers and treatments we have now will help us understand better how we're impacting cancer outcomes going forward. Can you talk about your role in helping to craft the many divergent requests into a cohesive program of public health for our country?
Wow, that's a hard one. So let me see. It's sort of so since become director, what it requires, Lisa, is really good working relationships with the other agencies that do cancer and with partner groups like yourself that do cancer work, right? None of us is an island and we have to work together. One of our biggest challenges at CDC is our budget. Our budget is probably 1/10 of what the NCI is. So we have to be extremely careful and focused when we decide that we're going to pursue an area because most of our money goes out the door for screening. Our screening program is our largest program. I think it's a little bit over half of our budget goes out to the National Breast and Cervical Cancer Early Detection Program that provides screening for low-income, uninsured women, which will be a bigger pool of people to serve now with COVID-19 pandemic, people losing their jobs, losing their health insurance. But that didn't answer your question. How do we come together? It really is about the major agencies, like the National Cancer Institute, the large not-for-profits like the ACS and yourself, sitting down and talking about what are the needs out there and how can we communicate those needs and how can we come together as one entity to make it happen.
Yeah, having that opportunity to work together. I mean, you and I are on the National Cancer Policy Forum, as are groups that you just talked about, the NCI and other professional organizations, as well as industry partners to talk about the most urgent issues. And certainly we've had a sort of bend in our agendas because of what's happened with COVID-19. I'd like to go back to COVID-19 just for a minute because, the Center for Disease Control, we think about pandemics as, being part of your bailiwick in general. This virus, has it impacted your ability to be able to continue with the initiatives you've started in the Cancer Control Division?
So I'll tell you, the COVID-19 pandemic has impacted every single thing we do. I think the one hidden thing that that the general public doesn't see is that a lot of our people that do our work at the state level have been deployed to work on COVID-19 in their states and localities, which means they're not there to do the work that we have funded them to do because they're dealing with something more urgent like the pandemic. And at CDC that occurs as well. Our employees get deployed to work on this internally because it is an emergency and we didn't have the staffing to address the emergency. So that's how we deal with things internally. But we have to make sure that our resources are clear when we put them out there. Getting feedback from people like, the oncology nurses about that didn't make any sense at all, Lisa. To bring it back. And I'm open for that because we don't want to continuously throw Jello on the wall and see what sticks, right? We need feedback from people that message didn't work or that one worked like a charm. So let's double down on that kind of thing and do more of it. But yeah, we just want to make sure that the information out there is clear. Some of the resources that we have on our website is a blog that I wrote right at the beginning of the pandemic on our This Is Cancer blog, as well as our website Staying Well While Staying Home. And those two resources together linked into the resources for CDC have been extremely helpful to the public.
Yes, and we've used them on our Oncology Nursing Society COVID-19 webpage and updated them regularly because we found them so valuable. Yeah, it is. It's so important right now because oncology nurses are dealing with patients not wanting to come in for treatment, trying to educate them about, precautions and, just the simple things, sheltering in place, physical distancing. What else should be done and what can nurses do to help people with cancer protect themselves during COVID-19?
I think what you just, your comment right before the question is really the most critical thing we can do. We need to be clear about what we know and what we don't know. Things that we recommend, I think the public thinks it can't really be that simple, right? Wash your hands, wash your hands, wash your hands, wash your hands. And no matter what, wash your hands, right? But that's a truism for cancer from the beginning of time. Right? Wear your mask. Your mask is really to protect others, but I saw some data a couple of days ago that it protects you as well. That's not the reason you wear it to prevent getting others people sick, but a new paper just came out to show that it also helps to keep the person wearing the mask well as well. And then social distancing, I will say, my own personal experience with the COVID quarantine is I feel extremely isolated in my house, right? Since March. And so one of the biggest things to do, is to use all of your mechanisms for staying in touch with people, right? Phone, Zoom, whatever it is you choose to do. I use the phone. I don't like all that electronic stuff, believe it or not. I love for other people to use it, but it's really not my thing. But to stay in touch with people, if you need care, I think you should never just stay home and suffer through whatever it is that's going on. You need to call your healthcare provider team, whoever you feel most comfortable with. And again, it's almost always the oncology nurses that are calling back. In the general population, it's the same thing, calling the office. And telehealth, we may get some traction on that, on telemedicine, telecommunications being paid for by insurers. So that would be a very big help. But some things you have to come in for, like your chemotherapy, as you just said.
Yeah. I have one more area I'd love to talk with you about. It's going to become front and center in the years to come, and that's vaccination programs. Let's start with HPV vaccination and then talk about sort of vaccination programs in general. What would you advise oncology nurses as they educate their patients and communities about vaccination and cancer prevention?
So the thing you just said is where I would start. The HPV vaccine and hepatitis B are cancer prevention vaccines. To talk about them that way, there may be some lessons learned from hepatitis B. It started out as an adolescent vaccine like HPV, but now we do it with babies, and there's not a question of, sexual activity, which disturbs parents of adolescent age children. We're going to encourage them to be having sex, which, they're having sex anyway, and we should protect them, right, from a cancer. And so, but that again is to start with the prevention message, not necessarily, what people concentrate on in the community is sexually transmitted disease angle, and go from there. Vaccine rates have dropped a lot in the last few months, and I'm hopeful that we can, again, getting people back into screening, getting people back into the mode of getting vaccines. And, I'll just speak now for the flu. The flu is coming. And to encourage people to go get their flu vaccine.
Right, and great points. And I think the HPV vaccination message that it isn't just about sexually transmitted disease, it has impact on oral cancers as well.
Absolutely. That paper was just in JCO about that. And I think the ACIP, the group that makes the recommendations for immunizations, made a statement on that as well.
Yeah, those are good messages for nurses to get out there and to share with parents, frankly. Nurses tend to be the trusted advisors in their families and communities and have an opportunity to really explain why vaccinations are important for preventing cancer.
Yeah, so one huge benefit for us at CDC working with you guys has been the entree into the American Nurses Association as well, because you belong to that larger organization. And I believe there's 2 million nurses in there. So working with you all, we've also gotten entree into the larger nursing community, which is very nice to get the message out about these prevention efforts that we're trying to do at CDC.
So glad you brought up the flu. I think we're all focused on the development of a COVID vaccine that we're forgetting that we actually have the flu season coming up again, and it's not that far away.
And the data show only a half of people get the vaccine, which is, unfortunate because I don't know, what is it, 30,000 or so people die of flu every year as well.
Yeah, so for this year of all years, we want to make sure that people with cancer, especially those who are receiving treatment that could affect their immune system, and frankly, everybody should get their flu vaccination.
Yeah, and we have some nice resources on our webpage, Cancer, Flu, and You, that you probably have seen, but we'll probably be getting ready to crank up our messaging around the flu here in the next couple weeks. So you'll be seeing more stuff coming out. We try to anticipate, because I've been to a couple places where they already have the signs up, get your flu shot, and I'm like, I usually wait till like end of August, early September, but I'll get it. My son has asthma, so we both go together, get our flu shot. So
yeah, those are really important messages, and we'll make sure that we get those resources up for our members as well. So we're at the end of our time, but I wanted to give you an opportunity if there's things we haven't discussed that you'd like to share with our members of the Oncology Nursing Society and nurses in general, Lisa.
Well, I think I said earlier, I mean, if you're members or yourself, if you see things that you think we should be doing or messages that you would like to see us work on, always get in touch with us. You can start with me and then we, can disperse it out to the correct people in our division. But my goal as the leader of our division is to make our services usable by people. You just don't want to post things and then just say, okay, we're finished. And also to continue to evaluate everything we do so that we can do a better job reaching people. And I would say that during this COVID pandemic time that we're in, to just do what cancer patients and oncology nurses and oncology providers just continue to do what we've always done. Again, wash your hands, wear a mask, and social distance when you can.
That's great advice. And we certainly appreciate all the resources that the CDC has on their website. And as I said, we reference those regularly on our COVID page and on our other pages for our members. So thank you for everything that you do, Dr. Richardson at the CDC. And we wish you well and look forward to the next updates that are coming out of your division.
Thank you so much.
Thank you. The NCCN has recently expanded its guidelines for the use of myeloid growth factors due to the COVID-19 pandemic. These guidelines now include chemotherapy patients at intermediate risk of febrile neutropenia. Visit the NCCN's website for further information.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.